Hi everyone, welcome back to my page. My name is Dr. Nkiruka Bridget at OB Talks with Dr. Adazion. I'm a consultant obstetrician gynecologist. Today, I want to give us some tips on how to take wounds at home before going to the hospital. I've seen a lot of people where they have a wound or a scar. Let's assume that there's hot water pours on them. The next day, or they have some injuries or a cut. You see the person doing some things that are not proper. Now, if you have a wound, please, the first thing to do is to put that wound under clean running water so that the water can wash off the debris, the dirt, everything that is contaminating that wound inside it. If you have a scar, like if you have a hot water pour on you or there is a burn, please do not pour raw egg on it. Do not pour sand. Do not get omo to pour on it. What you have to do is to get a cold water and pour on that area. Don't scratch. Don't put salt. So get a cold water and pour on that area so it will neutralize the effect, the thermal injury that is going on. So this is the first thing to do. Now, these tips I'm going to give you generally for every wound. If you have a cut and have some sand or debris or dirt inside it, just put it under running water to wash it off. Now, it's expected that for every home, you should have this. This is normal saline. This is normal saline. This is the one, the drip in the hospital. You can get this to use a very clean or sterile cotton wool, pour it in that wound or gauze, clean that wound very well. Clean the wound very, very well with this normal saline or with any clean water available. Clean it. If there are some things inside the wound that you cannot remove, don't go tampering to remove that thing, because if you remove it, it may start bleeding unnecessarily and that will become a problem. If you have wounds that are persistently, something is inside that refuses to come out, please move straight to the hospital. Now, when you wash this thing very well, we do not want you to use spirit on open wound. This is methylated spirit. We don't want you to use spirit on open wound. We don't want, look at it, it's written for external use only. I don't know if you can see it, just check through it. It's written for external use only. So don't use it on a wound that has a surface. You use on external places only. So don't use on a wound that has a surface. In a surgical wound that is broken down, as per when someone has done operation and is open, don't use this raw on it. We don't advise that. Use normal saline to wash it. After washing it, for first aid, you can use this. This is magnesium sulfate salt. You get a 50 cl bottle water and pour this sachet in it. Use it with clean cotton wool or sterile cotton wool to clean that wound. Now go to the hospital. The hospital will dress it very well for you. And if you are a nurse, you can properly dress the wound and leave it open. And leave it light dressing and close it. If it's wound that needs to be open, you allow it open. Just clean with this. Even some surgical places that is still paining you, you can use this. Don't use methylated spirit for us. I am begging you, please. This is for external use. You can use this one, not raw like this. Put it in 50 mils of, that is 50 cl of bottled water, clean bottled water, and shake it. Then use sterile gauze or cotton wool to clean the wound with this. That is one thing to do. Then the second thing is that you can use povidone iodine. For wound at home, it's good if you can get iodine. This is one. One of my professors gave me this. I don't know if you are seeing it. It reads PVP Jode. This is it. It's povidone actually, but it's povidone in gel form. I've been using this, that's why it's like this. So this one, after cleaning with normal saline, open this and press it. See the color? Like Povidone. Press it into that wound and apply light dressing. This is also for medical workers. Press this into the wound and apply light dressing. I bet you the result is outstanding. You can use ordinary Povidone iodine to clean. After cleaning, make sure before you apply this, the wound must be clean. You must have washed the wound and it's super clean. So you put this. Now, I have seen some people pour ampiclox or ampicillin on wound. Please stop. This is antibiotics. It can be taken orally. Stop pouring it in our wound. Please. Now, if you have a deep cut, you have to go to the hospital. There are other things that are used for cleaning wound or dressing wound. Others which will be used in the hospital include unadulterated honey. It can be used to make wound, especially deep wound. We use it to dress wound, and you see the wound get beautiful. That is not dirty wound that has been cleaned. After cleaning it, we use honey, and even if that wound is so bad, you will see the wound, those bad, we call it slough, start giving way, and the normal healthy tissue will start coming out. Before you know it, the wound will be so close that if it's really deep, we'll go back and close it in the theater, or it will heal on its own. So unadulterated honey, the main honey that is from honey bee, is used to dress wound also. Now another that is used in the hospital is maggot. Though I don't like that, but maggot does not eat. Maggot does not, maggot clears up dirty places. You only see maggot where there is a dirty environment. So what it does the same in wound. But please don't do it. Go to the hospital. The hospital you are visiting may use maggot depending on the nature of that wound and depending on whatever the person that is treating you wants. So maggot can be used to treat wound. So if you see a maggot on a wound in the hospital, don't say, this hospital is quack, they don't know what they are doing. No, they know what they are doing. It's you that don't know what they are doing. So that is for wound dressing, wound cleaning. The other thing is above this scope of this video that is used to dress wound, but that will be left for the hospital. So I'm going to tell you that for wounds that are persistently having these features, you have to visit the hospital. It is not something you will manage at home. If you see these things on a wound, please take that person to the hospital. Don't manage at home. Any wound that does not stop bleeding, you are managing a wound and that wound persistently continues to bleed and does not stop bleeding, it is not your wound to dress at home. Take that person to the hospital. That is number one. Number two, any wound that is very large or very deep, it is not your wound. Take that wound to the hospital. Now, any wound that persistently has a death or persistently has something embedded in it, it is not your wound, because just like I said before, if you go to remove that thing, it may be on a vessel and you'll not be able to control that bleeding. So if you have a wound that is persistently has a death or something embedded in it, take to the hospital. Now, another thing is that if you see a wound that is close to a major blood vessel, the wound is in the stomach, deep, maybe a knife stab, don't go touching that knife. Or a fall that has to stab the person through the abdomen, don't touch it. It is not your wound. Take that person to the hospital. Any wound that is close to any blood vessel, don't try it to go and dress that wound. Any wound that is on a joint, it is not your wound. Please take the person to the hospital. Then another is any wound that is given by an animal bite or human bite, please, is not your wound. Take the person to the hospital. A snake bite may require snake venom. A dog bite may require anti-rabies. Animals in the bush may require anti-rabies. Human bite may require even anti-rabies. Please, any bite, any wound from animal bite or human bite, it is not your wound to dress. Take that person to the hospital. Any wound that is very painful while dressing it, please refer the person to the hospital. Any wound that is persistently swollen or reddish or bringing out pus, it is not your wound. Don't treat that wound at home. Take the person to the hospital. Because when you get to the hospital, we may have to do what we call debridement, removing the slough very well. If it's something, it might be a knife or something, we'll watch and do the procedure, removing that thing, sometimes in theater or mini theater. Now, if it's a wound close to blood vessel, we already know the cause of this blood vessel and we'll be able to know how we are going to do. If it's a wound that is very deep and wide, after we have done everything, we may stitch it and bring it closer and then give the person mild dressing, and before you know it, the wound heals. Any wound that is persistently bleeding, we may need what we call we may need injection to cause the blood to clot. So it is not your wound. Any wound that is bringing out pus, we may have to pick something from that wound and send to the lab so that we know the organism that is causing it and we treat the person. So you see, those wounds are not yours. So please do not take care of the wounds that are bigger than you. However, for first aid purposes at home, just do what I have said. Now, some people will ask, what about hydrogen peroxide? Hydrogen peroxide may be used by some people in the hospital, but please don't use hydrogen peroxide at home because it forms a lot of gas that the body may not be able to handle it. And the next thing is that that gas may escape into the blood vessel and cause gas embolism. So please don't use hydrogen peroxide for us on any wound. Allow the medical personnel to take care of that. So thank you for watching to this point. If you have not subscribed to my YouTube page, you're looking for my trouble, subscribe at OBGYN Talks with Dr. Adazion. Follow me on Facebook page at OBGYN Talks with Dr. Adazion. I'm also on TikTok and on Instagram with the same name. Help us grow this channel. Share this video, like, comment before you leave. Thank you.